Hello, I'm Mark Perryman and I'm a Public Governor for South Central Ambulance Service, or SCAS. Over 400,000 people in the UK have rheumatoid arthritis, which is also sometimes called RA.
My name is John Black and I'm a consultant in emergency medicine at Oxford University Hospitals, and I am the medical director of the South Central Ambulance Service. In this question and answer session, we're going to be discussing rheumatoid arthritis and offer some advice to patients who are affected by this important disease, should they need advice or further care on an urgent or emergency basis.
So what is RA and how can you recognise it?
Rheumatoid arthritis is a long-term condition that causes pain, swelling and stiffness in the joints. The condition usually affects the hands and the feet and the wrists. It's a disease that's commoner in women than in men. It usually starts in the 5th and 6th decades of life. And affects up to 1% of the population.
What are the causes?
The cause of rheumatoid arthritis is not known in terms of what triggers the illness, but what is known is that the body's immune system starts to produce antibodies and starts to inappropriately attack body tissues. That results in inflammation and damage of those structures, and this particularly affects the joints, the ligaments, the tendons, and indeed the muscles that control movement of the limbs. However, as the disease progresses, it can cause an inflammatory response in the blood vessels that supply blood to the heart and to the brain. So it can cause heart attacks and strokes in patients with rheumatoid disease, and in severe disease when mobility is compromised, it also predisposes patients to falls and sustaining injuries in those circumstances.
What sort of treatments are available?
There are a range of treatments that are available for patients with rheumatoid arthritis. As you'd expect, drug therapy is important, and the types of drugs that are regularly used are broken down into two main groups. Firstly are the rheumatoid arthritis disease modifying medication. The second group of drugs are the so-called biologic therapies, which are recent therapies that have been introduced to manage the disease. The disease-modifying anti-rheumatic drugs that are frequently used include a drug that is used to treat, also used to treat cancer. It's a drug called methotrexate, and these drugs are designed to damp down the overreactive body's immune system to slow down the progression of the disease, particularly the destructive processes that can particularly affect the joints in the hands, feet and wrists. The other class of drugs that are used are the biologics, such as infliximab, and these drugs may be taken in combination with the disease-modifying drugs such as methotrexate. But the biological medicines are given by intramuscular injections, and again they work by preventing the release of chemicals into the body tissues that are known to cause particularly severe damage to joints. The latest group of drugs that have been introduced are drugs called JAK inhibitors. And again, further details of the type of medications and their side effect profiles can be found on the NHS website, If you search under rheumatoid arthritis, it can be easily found through a web-based search engine such as Google. There are important other forms of therapy other than medication, as you would expect. So the use of physiotherapy to maintain core muscle strength and limb strength is really important in terms of supporting patients' long-term function. Occupational therapists also have an important role to play, as do a range of allied healthcare professionals. Again, there's a range of resources and valuable information that can be obtained through the National Rheumatoid Arthritis Society that provides further details of the range of therapies. It's also not uncommon for steroids to be used again to damp down the immune response, and anti-inflammatory medication together with simple analgesics such as paracetamol and codeine are frequently used in combination to help control the pain that arises from chronically inflamed joints.
Can RA affect young people as well as older people?
Although rheumatoid arthritis is a disease that predominantly affects adults, it can rarely also cause a juvenile form of the disease in children and young adults. And in those circumstances, those children will require careful, lifelong follow-up and treatment.
What are the complications of RA?
Rheumatoid arthritis can cause a range of complications. The main group of complications are seen that affect the hands and the feet and the wrists of affected patients by causing inflammation and damage to the joints, to the ligaments, to the tendons and to the muscles that support the movement of the upper and lower limbs. Because the disease does cause an inflammatory response that can affect multiple body organs, it can also affect the blood vessels supplying blood to the heart and to the brain, and so therefore, and indeed to the lungs, and therefore it can cause chronic lung disease, it can cause heart attacks, and regrettably acute stroke.
So although people can be well controlled on medication, what happens if the disease flares up?
Rheumatoid arthritis is a disease that will be primarily managed by the patient's general practitioner. So it's important in the first instance that should the disease progress, should there be flare-ups, increasing episodes of pain that are impairing with day-to-day function, it's important that the GP is contacted ordinarily. However, if patients do develop severe disease that's becoming becoming a problem, particularly out of hours, then it is important that patients consider using the 111 service, whereby access to healthcare professionals will be available for further advice, and if necessary, those clinicians can arrange further follow-up in a range of healthcare settings depending on the nature of the urgent problem.
Can RA have an impact on someone's mental health?
It is well recognised that living with chronic physical disease can have very significant and long-term impact on patients' sense of health and well-being. And it is not uncommon, particularly when the disease may be difficult to control, particularly when patients have to manage long-term pain, that from time to time patients can develop significant mental illness, and particularly depression, that may require expert psychological support and intervention and management by community psychiatry liaison services.
So when would you call 111?
patients should consider contacting our 111 service when they feel that they need advice or assessment on a same-day emergency basis. So this may be because of to help in the management of long-term problems such as severe pain, or should patients develop perhaps side effects from them that may be related to their medication, and that there's a need for advice in terms of what to do next. Should patients develop symptoms of a heart attack or a stroke, so chest pain or severe breathlessness, then it's important that the ambulance service is contacted immediately via 999 so that we can provide emergency time-sensitive care in the community with a view to being able to transport patients onto expert secondary care to the relevant team, depending on the nature of the underlying emergency.
What sort of complication or emergency could lead someone with RA to call 999?
Should patients with rheumatoid arthritis develop potentially life-threatening symptoms, such as, for example, chest pain that's consistent with that being caused by a heart attack, or should they become acutely breathless, or indeed develop signs of acute stroke, then it's absolutely vital that patients contact the 999 service without delay so that we can provide time-critical, time-sensitive care to those patients, and importantly, deliver those patients, transport those patients directly to specialist teams in hospital for expert and appropriate care.